Transportation Department orders operators and drivers of public utility vehicles to strictly observe health protocols as Metro Manila shifts back to Alert Level 3. Joining us now is Transportation Undersecretary Artemio Tuazon Jr. Good morning, Yusek. Thank you for joining us this morning. Sir, just to clarify, to be clear, what is the allowed capacity in buses, jeepneys, and trains under Alert Level 3?
Morning, Ria. Yes, for this Alert Level 3 in the NCR right now, the passenger capacity for public transport remains to be at 70%. We will be maintaining the 70% passenger capacity for trucks, for jeeps, buses, and for our trains.
All right, 70%. That being the case, what other safety measures are in place when people get onto PUVs in order to avoid the transmission of the virus?
Yes, in order to avoid the public transport to be a vector for the transmission of the COVID-19 virus, Secretary Artugade has already ordered the strict implementation of the minimum health protocols within the public transport system, as well as what we call the 7 commandments in public transportation. This is the mandatory wearing of masks, no eating, no phone calls, the keeping of proper ventilation in the public utility vehicles, the frequent and regular disinfection of these public utility vehicles, and all those passengers who are exhibiting symptoms already of COVID-19 will not be allowed anymore inside the public utility vehicles, as well as the appropriate observance of social distancing within the vehicles.
Yusek, are children allowed on public transportation under Alert Level 3?
Under Alert Level 3, children or people below 18 years old are not allowed to go out except to access basic necessities and for medical purposes.
All right, Yusek, you mentioned the 7 commandments of public transportation. Firstly, how will you be sure that these will be properly implemented? And what would the penalties be for drivers found violating the safety protocols?
Yes, for our jeeps and buses, the LTO and the LTFRB already issued the respective memorandums already to operators and drivers to make sure that the 70% capacity is strictly implemented. For the operators and of these buses and jeeps, violators will be facing hefty fines as well as a possible suspension of their franchise. For the drivers, any driver violating the 70% capacity will also face a possible suspension of his driver's license.
All right. Now, regarding the kids naman po, you said that, they can only ride on public transportation for essential reasons. What would you consider essential reasons, and how will this be checked?
We have the LTO and the LTFRB enforcers who were directed by Secretary Tugade to strictly enforce the minimum health protocols inside the public utility vehicles. Basic necessities would include getting food for them, medical services, and other necessities that for the day-to-day existence. Now, we are also requesting the help and augmentation from the other regions, the LTFRB and the LTO enforcers from other regions to help us in enforcing this, as well as, of course, as the PNP.
Yusek, we'd also like to get an update on reports na may nag-positive po sa mga personnel ng MRT. What's the latest on this?
Yes, that's really true. We have been conducting antigen testing for all personnel of the MRT, not only the personnel from MRT, but also their service providers and their contractors. There were some who tested positive from antigen testing. And right now, we are conducting RT-PCR for this antigen-positive personnel. So all front-facing personnel of the MRT are subjected to antigen testing every day to ensure that they are negative when they face the public.
Lastly, Yusek, we also heard that the DOTr also plans to conduct random antigen tests sa mga willing at consenting passengers ng MRT and LRT. Can you tell us more about this?
Yes, that's also true. The MRT will be conducting, not only the MRT, the rail system in MRT, LRT 1, LRT 2, and PNR will be conducting random testing, antigen testing for their passengers. These are only for those who are willing or who volunteer for the antigen testing. This is meant to see and make sure that the level of COVID in the rail system is first to see if there is the presence of the COVID virus in the rail system, and also to see the level of the presence in the COVID, so that we may be able to address it and react to it appropriately.
All right, if a passenger were to test positive on a random antigen test, what would happen to them? They would have to leave the premises. What's the procedure there?
Yes, the passenger will be immediately isolated. They will be brought to an isolation facility and a RT-PCR test will be conducted on that passenger to determine as a confirmation of the positive result of the antigen.
All right, thank you so much for your time this morning, DOTr Undersecretary Artemio Tuazon Jr.